My practice has been designed to specifically address TMJ problems. So it's an orthodontic practice with an emphasis on TMJ and sleep breathing disorders. TMJ treatments are, they're very unfortunate that so few dentists want to do this. There's very little, if any, training in dental schools, so dentists in practice really don't even understand what to ask and how to diagnose. There are a few people who've decided to take training and provide that level of care. It's sort of a phase one care, meaning some way to reduce or eliminate pain, but there it stops. Few people have ever decided to, how can we heal or cure the situation? It's one thing to manage pain, it's another thing to offer a solution to that disease. And the TMJ is a really remarkable joint for as small as it is and as sort of inconsequential in many ways. It's a big troublemaker. It's the only joint in the body that really isn't a loaded joint very well. I mean, you load the knee, the hip, the shoulder. The teeth are the loading bearing or the load bearing area. The joint's an ancillary feature. And in fact, there are studies where people have had joints removed for trauma or for cancer or something, and they can function without a joint. Having said that though, if the joint is misaligned, and we typically think of what does that mean? Well, simply said, if the lower jaw is reacting to the underdeveloped upper jaw, it has to retrude or retract to get into fit. We talked about the biological need to survive, right? Chewing is essential for survival. The body will accomplish that at the expense of the joint, meaning the joint becomes compressed. So any joint that's compressed and reduces the functional space the body needs, there's going to be pathology in that joint. Well, what typically happens in this joint is there's cartilage, as there is usually between bones. That cartilage disc can be dislocated or displaced. And then every time you use the joint, every time you eat, open, smile, swallow, chew, you typically will micro-traumatize that joint that's dysfunctional. And over time, that can lead to a whole bunch of pain that you would think that joint couldn't produce. This joint is loaded with pain receptors, nerve endings, very sensitive area that has direct connections back into the brain more or less, meaning we now know through a lot of research that TM joint problems are a very strong precipitator of headaches, all the way up to migraines. Because the damaged joint is signaling the body or signaling the brain, I'm injured, I'm injured. The body really only has one reflex mechanism, and that is to contract the muscles around the joint to splint it. There's other evidence of that in other joints that are damaged. The body will try to splint itself to minimize movement to allow the joint to heal. Well, that sets in motion then these prolonged, contracted, fatigued muscles that then can create pain and precipitate clenching and grinding and damage to teeth. So the joint itself can irritate the brain, cause headaches and neck pain. The damaged joint can be painful itself, of course, but more often it produces painful muscles. The TM joint's unique as well because functioning of the jaw requires both neck muscles and jaw muscles. You could not chew unless your neck muscles and jaw muscles coordinated together. That being the case, if the joint is injured and the muscles are contracted around the jaw, guess what? The neck muscles secondarily become contracted. People report neck and shoulder pain, sometimes very strong conditions that can relate to that joint being dysfunctional. And then finally, as that disease progresses over time, there can be a state where the joint is then so damaged that the disc essentially locks the joint. The joint cannot open, and people have limited range of motion and very, very significant pain just while chewing. It's hard to open and painful to chew as well. So how do you treat that? Well, people have been thinking about it for years. There have been surgeries attempted with absolutely horrible success rates, I should say high failure rates. Different medications, different appliances, many things have been done, but in my experience, if you can rehabilitate the underdeveloped jaws, and you can think of it this way, if the upper jaw is developed into its correct size, shape, and position, and the lower jaw can then remodel and follow and come to its preferred physiologic position, you've immediately unloaded the joint. You've created that functional space. You can allow the joint to heal itself. And this joint is so unique in the body because it's a regenerative powerhouse. If you blow out a knee or you wear down a hip and you have to have it replaced, you're going to be in pain unless or until you replace it. This joint is unique in that if you reestablish a non-inflamed area and you create functional space, the joint can repair itself. It's a kind of specialized form of cartilage. It'll repair itself, which again speaks to the idea that you never really do surgery in that joint. Very limited times would you need to do surgery, very limited. That's the beauty of what we can do. If we promote correct positioning of the jaws, we get healing of the joint. Now, in my practice, I've done many things over the years. We currently use infrared laser therapy for the joint, very prolifically helps the joint heal. But I've come across another therapy called prolozone that has been a remarkable adjunct in the last year and a half or so. And what this is we know from alternative medicine that you can take, prolotherapy has been well known and well done, and it's been used for many, many years in different practice settings. And the idea is you use an anesthetic, typically procaine, and you mix it with a slight bit of dextrose, and that dextrose can stimulate kind of an irritant response that causes ligaments to tighten up. The anesthetic procaine has a nice ability to reset kind of damaged nerve endings and also facilitate a healing response where the nerve endings are no longer firing, creating as much of a pain response. In and of itself, by the way, prolotherapy has been shown to be effective even in the TM joint. But to my knowledge, there's only one paper out of 3,000 papers on ozone treatments for the joints on the TMJ. But there's this vast history of using it all across the world, injecting it into various joints within the body with phenomenal results. And when you understand what ozone does, it kind of makes sense. And I've been using it, so I've been using this prolozone. So we use the procaine, the dextrose, and the ozone. You can generate it and inject it directly into the joint. Extremely safe, low impact, not very invasive, with a tremendous stimulatory effect for healing. And I've had cases that were intractable pain or recalcitrant pain, not moving along, stalled out in kind of a partially healed, partially not healed state, having continual pain and limited ranges of motion of the jaw. Using prolozone, we get them over that hump and get them back to full functionality. And ozone is triatomic oxygen, 3 oxygen molecules bonded together very temporarily. But if you make it and immediately put it into the joint, the body absorbs it immediately. There's no harm. And the oxygen is very profound in its ability to stimulate a healing response. Ligaments have 1/10 the oxygen tension of connective tissue just next door, literally right next to each other. So ligaments suffer in terms of their ability to heal is impaired by the reduced oxygen tension that they normally have. That applies anywhere in the body. Ozone facilitates immediate delivery of oxygen to that tissue and promotes a rapid increase in healing. Added to which, tremendously anti-inflammatory, and there's been research. I show 5 different studies over about 15 years in my lectures where they've very carefully sampled the synovial fluid from the TM joint and found that it had various kinds of bacterial species in there. And that's remarkable, actually, to think that, and there's other evidence about that too, that there may well be in damaged, inflamed joints, there may be some bacterial harboring going on there. Well, certainly these studies showed that, and if that is the case, then ozone is the best known sort of sterilizer of everything. Antifungal, antiparasitical, antibacterial, kills everything. So if that was a part of what could be in that joint, it's going to eliminate that as well. So we typically only do 1 or 2, maybe at most 3 different sessions where we use that and to promote this healing, regenerative response. And I've seen it on CT imaging. I've seen a damaged, very arthritically degenerated joint, and 4 months later I see new bone, new forming going on. So it speeds up the healing. I've seen it in my own patients. They, of course, have reported tremendous, if not complete, elimination from joint pain. Now, you could use that as an ancillary strategy, but again, it's not going to cure that joint problem necessarily until or unless you correct the alignment. So you've got to get that compressed, damaged joint reestablishing a space, which means the whole jaw has to be encouraged to be in a different position, to allow that joint to heal, that disc to recapture. That's the idea of what we do. The orthopedic, orthodontic jaw development strategy we use allows that to happen. The most profound, I've been doing TMJ treatments for 22 years. And I usually was doing appliances called TMJ appliances or orthotics, and I would restore a case to try to create a solution. Successful in some cases, but I have never been as successful as I have been with this strategy. If I can get to the root foundational problem, underdeveloped jaws, and allow the jaws to remodel, we can correct that TMJ problem as a much more permanent solution.